Our speaker today is Andrea Parker from the Hult Center, and she's the Executive Director for the Hult Center for Healthy Living at Carle Health, Greater Peoria. Andrea has 40 years of experience as a registered nurse with a background in pediatrics nursing, medical surgical nursing, community health, and public health. Andrea has received her nursing degree from Methodist School of Nursing, later completing her bachelor's degree from Bradley University and her Master of Science from the University of Illinois at Chicago. Andrea jump-started her nursing career as a pediatric nurse with Methodist Medical Center and had the opportunity to work within home health and family practice, which prepared her for community-based nursing roles, such as overseeing Carle Health's Methodist Medical Center's school health program, which she helped create over 20 years ago. Prior to taking the helm at Hult Center for Healthy Living, she served as a regional health officer for the Illinois Department of Public Health, and previous to that, held the public health administrator position within the Peoria City County Health Department, overseeing multiple counties. She's a recognized health leader in the community, serving a variety of community agency boards. To list a few, she served as president of the Rotary Club of Peoria downtown. She's no longer a member down there. She needs the Rotary Club to come to, so encourage her. President of the Crittenden Center Board, Human Service Board member now, truly in place with Carle Health. Andrea has an extensive list of awards and achievements, among her recent accomplishments being inducted into the Bradley University Centurion Society, receiving the 25 Women in Leadership and the Women of Influence Awards. Other professional recognitions include induction to the Peoria African American Hall of Fame Museum, Those Who Excel Award from the State Board of Education, as well as recognized as a 40 Leaders Under 40. She holds an adjunct faculty position with Carle Health Methodist College, teaching both undergraduate and graduate nursing. She has also held adjunct faculty positions at Bradley University College of Health Science and the University of Illinois College of Nursing. Andrea?
Wow. Good afternoon, and thank you. Thanks for the introduction. And yes, I'll just call you my Rotary brothers and sisters, because yes, it does feel good to come to a meeting in the north side. We try to remove the downtown, just go by the Rotary Club of Peoria. But that's
closer drive for you to come here.
I know. Okay, am I doing this? So thank you. Leah invited me to talk about and I didn't come up with the title, but what I was thinking of, for those of you who've ever heard the radio station and it says, what's going on at the Peoria Courthouse, I thought that's what we're going to do today. What's going on at the Hult Center? As many of you know, we've been around for a while and we've gone through some changes. So I'd like to just give some updates today, and I appreciate your attendance and allowing me to speak as well. So as many of you know, we've gone through some renditions. We opened our doors in 1990 with the impetus of Dr. Stephen Bash, who came to Peoria a little over 30 years ago for pediatric cardiology with OSF. Brought his lovely wife, Patty Bash, pediatric nurse. They came up with the idea when they came from Fort Wayne, Indiana, that Peoria didn't have what they had. It was really health education in their community. As you know, with most school districts, one of the first things they cut are those extracurricular activities, and health education was one at that time, during that time period as well. Some of the renditions we've gone through: 2013, Illinois Valley Mental Health Association, for those of you who've been in the nonprofit world for a while. They also joined the Hult Center in 2013, their board, and we inherited their programs and staff. In 2014, we became a part of Unity Point Health, and now Unity Point's gone, and we have become a part of Carle Health as of 2023. We refer to ourselves as Greater Peoria. Carle has 8 hospitals, with Peoria Region, Methodist Proctor Hospital, and Pekin Hospital being the Peoria region. Everybody else is really east and south of us for the other 5 hospitals in the Carle system, with home base for Carle being in Champaign-Urbana. My lovely staff. So our team of health educators, Hult is staffed with all health education from bachelor's to master's prepared people. We precept as well through the registered dietitian program at Bradley University, as well as ISU, Bradley, and any other of the colleges and universities who'd like to send us interns. We probably hold about 12 interns in a given year for health education, registered dietitian, and nursing. I'll take at least 1 or 2 a semester. So basically our team, age appropriate is what we really, consider our curriculums, evidence-based. Historically, we've always taught kindergarten through 12th grade. And over the last years, as you'll see us, as we've kind of morphed into adults, older adults, as well as young adults in the curriculums that we do now. We still support our youth in setting goals and developing their positive behaviors. We teach, in our mission value statement is, empowering people to live healthier lives. Whatever that means, that is what we really address in all of our programs. We create those safe, inclusive spaces. As you know, we've gone through the LGBTQ+ lifestyle. We make sure that when we're in front of everybody, we speak with those inclusive languages, especially our youth who are struggling with their own identities. We need to recognize that we need to, emulate and try to support and welcome everybody where they are in their life. We work with families, schools, other community partners. We too have received grants from the Rotary, both sides as well. Just a list of a few. My staff put 400. I couldn't come up with 400, but they must be 400. But here are some of the agencies who support us, whether it's volunteerism, financially, grant-wise, allow us to teach in their space and vice versa, just to list a few here in our own community. One of the roles that we've had, and I called in our new phase, we participate in the community health needs assessment. Raise your hand. Are you familiar with the terminology? Okay, so a couple people. Basically, over the last probably 30 plus years in Illinois, and I can speak just on behalf of Illinois, we've had what we call in the local public health world is community health needs assessment. So local public health in all the counties, 102 in Illinois, have been doing community health assessments for years, and then they come up with strategies to help improve the health of their communities. Over the last 10 to under 15 years, CMS federal government decided hospitals, you need to participate as well, because what health issues go on in the community end up in a hospital, and they make money, they get paid for some of the chronic diseases that are actually all preventable. If you think of the chronic diseases, hypertension, diabetes, some of the other ones that go along. So what the role Hult plays in there now is we too, in the last probably 10 years, also participate on the boards. I sit on the board for the Community Health Needs Assessment for the Tri-County. Peoria, Tazewell, and Woodford counties all get together, and we plan as a community what's going on health related in your community. And then we track that. We spend a year collecting data. We spend the second year planning what are we going to do about it, the third year implementing, and the fourth year evaluating. And that gets turned into the state of Illinois for all counties in Illinois that participate. Well, it's not optional in all hospitals. It's required now by the federal government. So you can see the area that we use here. So Peoria, chronic disease prevention for us at the Hult Center, we have, I call it in-house and outreach. So our health educators actually go out into the community. We're probably within 40, under 50 miles in any given day that we go out to school districts, local agencies, as well as other community-based agencies and facilities. We have our WELL program, which was formerly kind of the impetus and funded by our Peoria Local United Way. And basically what the WELL program does, it helps us identify children under the age of 18 who may be pre-diabetic or have high risk for diet and nutrition issues. They can come to our counseling sessions and exercise sessions at no cost. Our staff go out in Peoria Public Schools. They will meet the students at home. They will meet the students at the Hult Center. We can go anywhere that makes the families convenient for them to work with their children and follow them to help them. They're doctor referred to this program or self-referred as well, again, at no cost. Our adolescent health empowerment program, also we work pretty closely with our school-based health centers. As kind of a dual role for myself, I have a dual report. I oversee the Hult Center, but I also oversee all of the school-based health centers and school health in Tazewell County, East Peoria School District, and Pekin, as well as Peoria Public Schools. So we work really closely with our school health programs to make sure the students are getting the needs that they have taken care of, whether it's behavioral health, and then helping them learn to transition. And when we say transition, what we mean is, especially for those students who've had a school-based health center in their life for maybe kindergarten to 12th grade, when they turn 18 and are turned out of, maybe adult care, how do they keep going and making sure that health is a priority. So we teach them starting freshman year in our high schools about their own health. What do they know about their parents' health? So if any of you show up in the emergency room and they say your blood pressure is 120/68, do you say, oh, that's good, that's what it normally is? Or do you go, oh, that's way too low? Or, oh, that's way too high? So we teach our kids to know those same things about themselves and awareness. So if they show up in a health facility, they know a little bit about themselves and maybe whatever they can learn about their parents for that health history that goes along with a health visit. And then we also try to connect our adolescents to a health provider. So when they turn 18 and a trip out, we don't say they have to go to Carl. They might be in the OSF system. They might be in our local FQHC, which is Heartland. Just trying to teach them that health is important and how to be empowering them to take control over their own lives as well. And actually, my glasses, I can't see the third thing. Sexual and reproductive health is actually one of my main favorites because it's the only education curriculum that we have that one of our classes, it brought 44 parents. We also do drug and substance use classes. I get no parents. They don't care what we tell their kids about drugs and alcohol, but everybody cares what we tell their children about reproductive and sexual health. And basically, again, it's more of an empowerment. It's a self-awareness. It's teaching students how to make healthy decisions and have healthy behaviors. We do have 4 theaters for those of you who are not familiar with the Hult Center, and I always welcome, a tour or a visit for people. We also have a curriculum where we invite those parents who can't come during the day when we're doing our reproductive health classes to come on a weekend, to come on an evening. We'll schedule a private time for a family so those parents can see what we teach their children. We're also online. So our curriculums are all online. They're all public-based so that people can see what we tell. We teach fact. Mainly 2 things people care about the most, abortion and sexuality. We just teach fact, and we go through the curriculum that the Illinois State Board of Education has that we support as well. So we don't tell anybody's kids things are right or wrong. We don't do ethical conversations or anything of the nature. And our Youth Mental Health Matters. We got involved in youth mental health, as you saw earlier in 2013 when Illinois Valley Mental Health Association closed their doors. We inherited a lot of their behavioral health programs, but we also were asked specifically by Peoria Public Schools to help address the needs that they were having amongst their students in behavioral health. So we hold grants in behavioral health we start pre-K up to adult size at this point, medical students as well as residency program here at Family Practice Residency as UEComp Medicine, University of Illinois College of Medicine here in Peoria. And we do their students as well to recognize those signs of suicide awareness. We're really, approaching that where this is rough times. Pre-COVID, especially post-COVID, we're still having youth and adolescents that are, having a really hard time in the mental health space. So we do have those programs. And upcoming, if those of you who are not familiar, the annual Whitney Walk for Life, or the Whitney Walk event that we do is a walk run at Jubilee State Park. It's always held the last Saturday in July. We raise funds for that walk run just to support all the programs that we do in mental health here in Peoria County. Advocacy and policy is something that we also do. We hold grants from the State Health Department on addressing public smoking. We hold grants that address, again, youth empowerment clinics and things of the nature, again, suicide awareness, and then partnerships with our healthy community and involving our community health planning, what we're doing, and we're in the midst of it right now. Mental health, a large part, again, is what we have here for us. Again, you'll see our Whitney Walk is coming up, the walk run. And for those of you who don't know, that was a local family out of Brimfield who lost their daughter to suicide when she was a freshman or a sophomore, but almost 20 years ago out of Brimfield. That family and some of their closest friends put that walk together, and we've held that, I think it's going to be 21 years this year that we continue to do that walk run. Field trips at the bottom, I talked about us going out for 40 or 50 miles. We still hold field trips in. So those of you who have been to the Hult Center, we still have 4 theaters. We have a diet nutrition theater, we have a substance use theater, we have a reproductive health theater, and a healthy nutrition eating theater. They're still the same. They've been like that for 30 years. So we're trying to go through renditions of updating and becoming more relevant. And then all the things that we do for mental health education, we have a brain program. The QPR at the bottom, question, persuade, and refer, we actually go out to agencies. agencies invite us. We've been to, I can't think of all the agencies right now, where we go into Caterpillar, you name it. Any agency that wants to invite us, RLI has invited us over the years to talk to their adult staffing or their employees, team members, about suicide awareness, mental health, depression, and some of those other things, so that people can be more aware. Healthy eating, active living, again, obesity, we do address these programs through our WELL. We work on the high-risk zip codes of 03, 04, and 05, which is, as you read the data for the state of Illinois. Julie knows this all too well. We live in the, we've been labeled in our 61605, where I actually grew up and went to Manual, as one of the poorest neighborhoods in the state of Illinois, zip codes. That's amazing that we even made that state marker, knowing that. Again, a little bit about the WELL program, our nutrition. We do hold, again, the internships for the nutrition. Brandon University holds a nutrition RD, which is a master's program and an undergrad bachelor's program. They actually rewrote one of their curriculums a couple of years ago, and it's under community health. So it used to be more specialty. We held their registered dietitian students and their nutrition students in oncology. Now we do them in community health. So they're out program planning with my health educators on how to help people eat healthy overall in general, making plans, boards. They're doing a lot of work in the community. Again, reproductive health, again, it's the most popular one of our things that parents really care a lot about. And I remind my team too, sometimes it's not people care what we're actually saying, but a lot of people, especially young adults who have those youth and adolescents, or even the younger ones coming up, don't know how to talk to their children when it comes to reproductive health or sexuality. So sometimes I think parents come to hear, how do we interpret, how do we talk, how do we have those conversations? I'm a public health nurse, so my kids know I don't have any taboo conversations. They probably have heard everything. All of my grandchildren have come to the Hult Center and looked at all the diagrams way before they were at the age where they should be. And I know one of my twin grandsons, they're 13 now in the Dunlap system, and we start reproductive health at 5th grade, so that's what, 10? So when they were like 8 and 9, my kids play at the Hult Center mostly. They're in their room with all the reproductive health of the female and the male body parts. My grandson goes, do you know what happens? What happens? Everybody else knows what happens. And I said, well, you're going to have to wait to 5th grade. They were like, because they've come in, they've held and touched everything that we have. So, so it won't be such a big deal when they get there. They won't be like, nothing's mystical. So, but yeah, it is kind of fun. So we do hygiene, puberty, understanding, STIs, condom prevention, as you can see, our mannequins that we use. And I have to say, I'm so impressed with my staff. I had the opportunity to go to Peoria Public Schools, the Knoxville Center, which is on Knoxville, where they have students and they have like a different learning schedule. They go a little later, but they can return back to their home high school here in Peoria Public Schools, or they can graduate from there as well. And we did a sexuality class at that particular school one day. There's a room of about maybe 17 young men. I had a female health educator, and the questions they asked her, I felt like they would not get good answers anywhere on the streets. So it's really, really nice to have the right information, the right time, and have them actually participate. We put up such a relaxed environment. Kids like to say things for the shock value. We don't have that shock value. We welcome all questions, and it's really fun to watch because they think they're shocking when they ask some of their shock questions. But when my staff give it back and they're female and they're male, it is a lot of fun to watch. So safe zone training, again, the LGBTQ plus curriculum that we follow, making sure our flash curriculum is all State Board of Education, which is our reproductive health programs as well, and how to talk about the talk. How do you talk to your young girls, and how do you talk about sexuality to your students when they start asking questions? So even my own daughter, who's now 39, I would say is, because my singer knows all, I think, me to my children almost. But anyway, when she was 8 or 9, she had a little bit more body fat. So when girls have a little bit more body fat on them, they're apt to start their periods earlier. So she was, I thought, I'm going to get her prepared. We used to go to the grocery store, look at all the pads and all the things you could possibly have. So when she started her period at, I think, 6th grade, I took the day off, thought we were going to have Mother-Daughter Day. We're going to go to the store. We're going to have this great day. And she looked at me and she threw her book bag on her shoulder. She says, I have basketball practice. Like, don't you have anything else to do? The happy part of me was, wow, having a period for the first time was no big deal. I gave her her pads, gave her all the things she needed, away she went. The other part, I felt a little robbed because I thought my daughter's growing up and she had no chance to spend the day with her mom. So it's kind of a twofold for that. Just a little about the statistics for us. As we saw, we've seen 29, almost 30,000 students over the 2024. Kind of a breakdown of who we do see. Our youth at 11,000. Our adults who are participating in our suicide prevention programs. Our students have received, any adolescent-specific education, asthma awareness, sexuality, as you can see. And we also, this year, I will say, we had more homeschool associations as well as school districts reach out to us that we've never had over the years, and maintaining those that we still do for reproductive health. We also do the Jameson School, any adult disability people. We saw more of those associations come through us this year than we ever have. So that is good to know that everybody is interested in, again, removing that stigma that you're not supposed to talk about it, because our role is if you don't empower people or educate, our students won't know how to make good decisions as they become young adults. Again, our WELL program, and then again, just our safe zone practices as well. That's the Hult Center. That's what's been going on. Yeah, I do. Questions? Yes.
Good to see you again. It's been a few years. From most of the patients you've heard, we're just a joy to listen to.
Well, thank you.
My question to you, and I don't know if it's a short answer or a long answer, but being raised in the 605 zip code area, and you're very successful, how did it happen?
I'm going to blame it on my mom and dad. And I think, we grew up in an era where, survival was a big deal. Our neighborhoods were mixed. We weren't that segregated, back in the day. Even when I went to Manual High School, I will say it was predominantly more white than black students at that time. A lot of Catholic students. But we seemed in the 70s, we got along a lot better. This is just a different time I think we're in. And poverty, as you can look at our federal government, poverty is about to get worse. I think you learn to survive. And I remember when my children were growing up, we thought just differently. My husband and I looked to put our children in private school. And my parents said, why would you shelter them that way? Throw them into the world that they grow up in so they'll learn to survive. So my children, as well as my grandchildren, all attended Peoria public schools. I like to think they're successful. They've got their masters and their degrees, and their kids are coming along successfully. Of course, I do have 3 in the Dunlap system. They're little people. But yeah, I think it's, it's a mindset. You can be successful or fail in any zip code. I think it's what you choose to do as well.
So my parents took a balance class at the Hult Center. Can you talk about the other older adult
Matter of
options
balance.
you have?
Yes, so we don't do them as often, so we don't advertise them as often. We still do have the Matter of Balance Fall Prevention Program for our older adults. And actually, the instructors are Methodist College of Nursing senior students doing their community health, population health rotation. We only do it when the faculty is available. So we used to hold it more regularly because my staff taught it, and then the college wanted to assume it as well. So when they have a curriculum, we host it. So outside of that, we haven't had as many senior programs on site as we used to, as much as we do more education. We still do hold the annual senior health fair, which we partner with Triad, Peoria County's Triad, so that still does exist. And then any other adult activities that want to come to the space, we just don't have the capacity. I went from a staff of 16 to a staff of about 8. About half the staff I was 10 years ago. So we kind of had to pick and choose where does grant funding take us as well, and participate in those programs.
Andrea, you mentioned having the population health rotation. Do they collect any social determinant of health data, and if so, what do you do with it?
Yes. So when you say population health rotation, the students do, like the college students do collect that as well as we do. We use a lot of the data that we collect as documentation, evidence-based when we apply for grants, because most things that are supported by grants want to make sure you're reaching out to those target populations and people who need you the most. Now, I don't know what the college does with their material. A lot of ours is really just banked in the database, for grants and things like that. And with the community health needs assessment, collecting data too, it kind of drives our tri-county of where do we need to spend our resources and our time to help those who need us the most. I appreciate your time. Thank you.